Morning, everyone. Dr. Eric, the fitness physician. So today's another quiz day. I love quizzes. It's kind of fun, right? So I'm going to keep everyone on their toes. This one, I was talking about PCOS this week, polycystic ovarian syndrome. It's a very common endocrinopathy in women. I see it all the time and treat it. So question comes up a lot about thyroid, right? And I talk also about thyroid. I treat a lot of thyroid conditions with men and women. So what is the relationship between PCOS and thyroid? A lot of people say, why do you put women on thyroid? Or how do you look at their nutrient status or genetic factors? Why are you evaluating their thyroid function, thyroid antibodies, etc. when someone with PCOS? Aren't they two different things? They are, but they're very interrelated. And there's actually multiple answers to this question, so it's kind of a trick question. But the main answer, and not to get geeky, but it has to do with the conversion of T4 to T3. T3 is the active thyroid hormone, right? And women with PCOS have a problem with converting T4 to T3. And this is why their T3 levels are often low and they're symptomatic, even though some of their other numbers like their TSH, etc., are quote unquote normal. So there's an enzyme called the 5' deiodinase, which converts this, right? And it's decreased, the function is decreased somewhat in a lot of people, but definitely in women with PCOS. Therefore, they need thyroid. So it also comes down to insulin resistance and metabolism, right? And that's, of course, the main underlying factor with PCOS is insulin resistance, which needs to be addressed with diet, lifestyle, nutraceuticals, and then, of course, hormone optimization. And sometimes it can be very tricky, and there's a lot of moving parts. And like I always talk about with hormones, there's multiple, it's like a dominoes. There's multiple pieces in place. You affect one and it affects the others, not just the ones that people think about, but a lot of other ones too. Cortisol, leptin, ghrelin, so many other hormones. And that's why it takes a very unique approach, and that's how I do personalized care with my patients. It's not just a cookie cutter textbook approach. Everybody gets the same thing, like you see with internet gurus and fitness professionals touting to be hormone experts. Not to get on my soapbox again, but I see this all the time because people just kind of go see people that look good on camera or whatever, and have interviewed a few docs like myself, and now they're experts, right? And then they don't, and then they have problems, they have symptoms, they have bad outcomes, and they're not getting the results they want. And I know because they come see me, and I have to fix them, and which is fine. I'm happy to take care of them or send them to one of my colleagues. But it's very tricky, and even myself, sometimes it takes me a little while to figure these things out. Peel back all layers of the onions and get all the dominoes lined up perfectly, right? So I love analogies, so it's a good way to explain. So the bottom line is quiz time. So that's the relationship between PCOS and thyroid. And again, it's a very delicate balance, and a lot of factors come into play, like I said, especially with insulin resistance and overall metabolism, especially adrenal health, as I've talked about adrenal health and thyroid conditions being very interrelated. So anyway, I hope you enjoyed that quiz. Tune in next time. Please like and share this post, and comment below if you have any problems with PCOS, problems you've had, or if you need help. Reach out to me and we'll talk to you soon.